Good afternoon, everyone. My name is Bruce Holstead. I am the interim executive director here at Fresh Start Recovery, and I don't have a lot of responsibilities today, but one of them would be some housekeeping items. I'd like to point out that there's a washroom at the front, emergency doors at the back, and today we will be following REP COVID regulations. That said, I would be amiss if I didn't take an opportunity to say thank you to Premier Kenney, Minister Ellis, and the countless Alberta government employees who have helped pave the way to recovery. So on behalf of our board of directors, our staff, clients, and most importantly, community, thank you for making recovery available to so many more Albertans. Sorry, I get nervous, eh? My last responsibility is to introduce you to a wonderful young man who, like many others, has fought to find this path to recovery. Grant Dowell has worked hard to get here today. His determination, dedication, perseverance, he's made it through our 90-day program, and he stands confident in the direction he faces today. So I'll humbly ask Grant to join us, sharing some thoughts, some feelings, and some insights about recovery. Come on up, buddy. Just be you.
Good afternoon. Thanks, Bruce, for the introduction. My name is Grant, and on Wednesday, I completed the program here at Fresh Start. When I was in active addiction, it was torture. I couldn't cope with life, and using drugs and alcohol seemed like the only option. I got so low at times, I tried to take my own life. I was trying to fill a void. I was trying to solve an inside problem with an outside solution. I knew I needed to make a change. For my family, and most importantly, my son. My recovery started at the George Spady Detox Center in Edmonton. When I was about 3 weeks into my journey at the Spady, I ran into Mike Ellis while he was touring the detox. He stopped to talk to me about my addiction, what brought me here, and where I was going to treatment. He offered to help me to come to Fresh Start, and I came to start a better life in recovery. Coming to treatment at Fresh Start has completely changed my life. Today, I am full of hope and gratitude. I'm able to show up for not only my life, but for my family and my friends. One of the greatest joys in recovery is getting to reconnect with my son. When I was in active addiction, I couldn't be present. I couldn't truly be there for him. Now I get to be there for him 100%. Mike, I want to thank you for taking the time to talk to me when I was in detox, for taking the time to help me, and for giving me this opportunity to find a better life in recovery. I would also like to thank you on behalf of all of the men of the house here at Fresh Start. You have given many of us the opportunity of a lifetime to get treatment and enter recovery. If there's somebody out there watching right now, just know that there is help available, and there are people who truly care about you. And with that, I'd now like to welcome Alberta's Associate Minister of Mental Health and Addiction, the Honourable Mike Ellis.
Wow. I was a big downtown copper for a long time, and, it's stories like that bring a tear to my heart. Grant, I'm so proud of you, man. Just so proud of you. So hello and welcome, everyone. This is a great day. Thank you, Grant, for that introduction. I am so incredibly proud of you and all the men who have graduated on Wednesday and those who are here, right now. Today is a big day for recovery here in Alberta. I cannot tell you how proud I am to be your Associate Minister for Mental Health and Addiction and to hold that position in a government that is completely committed to helping people pursue recovery. I spent 12 years on the streets of Calgary as a police officer. I worked with countless individuals who were struggling with addiction and mental health issues. Each and every person I encountered was unique, but what was common, the very common theme with them, is many of them wanted to pursue recovery. But there was no support for them to do so. And this, of course, is completely unacceptable. No Albertan should ever be left without hope for recovery. Since we took office, we have been hard at work building a recovery-oriented system of care, a system of care that supports you to access life-saving treatment and recovery services, no matter who you are or how much money that you may have. Armed with $140 million in new funding, we set out to build this system. We started with the announcement that we would be funding 4,000 treatment spaces annually, an initiative that is well underway. We licensed residential addiction treatment facilities to protect patients and improve the quality of services. We've announced funding to support the treatment of thousands of Albertans every year, whether that they be through medical detox or residential treatment or residential recovery services. We've eliminated all user fees for publicly funded residential treatment to ensure that everyone has the same access regardless of their background. Alberta is the first province in Canada to completely eliminate user fees for publicly funded care. We've joined a class action, and there are other provinces following our lead on this. We have joined a class action lawsuit with provinces across Canada to recover the costs that we're incurring as a result of the OxyContin that started with the opioid crisis. We've dramatically expanded the provincial drug treatment court system, giving Albertans the option of getting treatment for their addiction instead of going to jail. We've created a recovery coaching program right here in Calgary. Now, some of our recovery coaches are here with us today, so let's give them a round of applause. Hey, the folks in the blue jackets, stand up, stand up. These recovery coaches share their experience, their strength, their hope to guide people to meet their individual goals. These are people with lived experience that can relate to the folks that are on the streets in order to help them in a pathway to recovery. Now, I could continue to go on about all of these things that we have accomplished, all the great things that we have done, but the message here is this. We are building a system of care that helps everyone access treatment and recovery. We're building a system that leaves no one behind. This is a recovery-oriented system of care. To hear more about the new system that we're building, we have with us here today the man who started this vision and has ensured that we have seen it through. Ladies and gentlemen, I would like to welcome my good friend, our leader and recovery advocate in chief, the Premier of Alberta, Jason Kenney.
Thank you very much. Thanks, Mike. Thank you, folks. Thank you so much. Mike, thank you so much, Bruce, for welcoming us here. I see we're also joined by Calgary Klein MLA Jeremy Nixon, who himself has worked in the recovery area, and thank you so much for your passion. He's also Parliamentary Secretary for Civil Society, helping out with particular issues around homelessness. But most importantly, thank you, Grant, for those incredibly moving words, but really the actions behind them, where you've taken control of your life to get well. And I think everybody has somebody in their lives and their families who have struggled with addiction, and I know how hard it's been for you and your family. So God bless you. What a beautiful message, and we wish you just graduated on Wednesday. How about a big hand for Grant? Congratulations. But Grant, you're from Edmonton, so I assume you're an Oilers fan, eh? It's just pretty much all the graduation jerseys here look like Flames jerseys. I don't know what's going on, but they don't get a choice. Anyway, it's great to see all of the folks who are here living at Fresh Start, and thank you to the board, the staff, the recovery coaches, and everybody here at Fresh Start who have helped to save hundreds of lives and turn around thousands of lives. So I am really pleased to be here to highlight Alberta's commitment to help people struggling with addiction. To anyone out there who may be struggling with addiction, I want you to know that we care and that recovery from addiction really is possible. A lot of folks in this room, and so many beyond it, are evidence, are proof that addiction and all the personal and social damage that it causes is not just a problem to be managed, but it is one that can be solved. Effective intervention and treatment can lift people from social isolation, from poverty and self-destructive habits, and help them rebuild careers, restore relationships with friends and family, and regain their health and wellness. And in fact, during the last election, that's what we committed to do. In the past, a large number of our addiction treatment beds in Alberta went empty every night because of a lack of money. And despite a growing addiction crisis, too many people couldn't access treatment. Families were having to choose whether they were going to sell their car or remortgage their home in order to access care for the loved one that needed it. For those who could afford it, too often they went to the front of the line, while those who couldn't never got in the line. This lack of access was unacceptable, because we know addiction is an illness, and we know that with proper treatment, recovery from this illness can and does happen. But despite the success of people like yourselves who have pursued recovery to improve your lives, treatment too often has been neglected by politicians and bureaucrats in the health system in favor of an obsession only on addiction management. Now, harm reduction does have a place, I believe, within the spectrum of public health response to help prevent overdose. But I want everyone here and those watching at home to know about two vital harm reduction and treatment services in our new system of care. The virtual opioid dependency program is available for all Albertans to start life-saving opioid medication anywhere in the province with no wait lists and fees. You can begin treatment today simply by calling 1-800 and the number that you see here on the stage. For those who are not ready for treatment and who may be using at home alone, please download the Digital Overdose Response System, that's the DOORS app, simply by scanning the QR code that you see up here on the stage, or by visiting an app store on your phone. So that's, again, the Alberta Digital Overdose Response System app. It's a highly confidential system that will dispatch an ambulance if you become unconscious. Our government is taking an expanded and balanced approach to fighting addiction and overdoses in Alberta. I committed in our platform to invest $100 million in additional funding over 4 years in this fight, plus an additional $40 million specifically to combat the opioid crisis. And since then, we've added over $100 million additional support through the COVID period. An opioid crisis that has tragically gotten worse as a direct result of the COVID-19 pandemic and the related restrictions and the way it's impacted all of our lives, a trend that we've seen across the country, not just here in Alberta. And let's be clear, each life lost to addiction is a terrible tragedy. And we owe it to those we've lost to provide more and better access to treatment so that no Albertan is left without hope for recovery. Recovery needs to be viewed positively as a valid, desirable, and achievable goal by the healthcare, legal, and social services systems, as well as the broader community. We must reject those who say that recovery is not possible and only facilitating addictions is the right approach. Our vision, Alberta's vision, is one of an accessible, recovery-oriented system of care based on a careful assessment of each individual's circumstances and needs, tailor-made for each person. A system of care that focuses on individual strengths and goals to help someone pursue a better life. A system of care that provides timely access to a range of services that meet the highest safety and quality standards. Everyone with addiction should be informed about all of the treatment and recovery options that are available to them at every point in the system. So this means if someone's going in to a supervised injection site, the staff there shouldn't just be there to help them shoot up. The staff should be there to help them provide a way out of the addiction. It is this vision that has formed Alberta's response and led to the significant commitment I made 2 years ago at the Recovery Capital Conference held by recovery coaches from across mainly Western Canada. I committed then that Alberta's government would be creating 4,000 newly funded treatment spaces for Albertans suffering from addiction. This meant an extra 4,000 Albertans would be able to access the kind of care that Fresh Start provides. They would not have to choose between sending their kids to play sports and getting themselves the health care that they need to improve their lives and turn it around. I said then it would take 4 years to achieve that big goal of 4,000 extra spaces. Well, I'm very happy to be here to announce that 2 years ahead of schedule, and despite the global pandemic, Alberta's kept its promise and funded over 4,000 additional treatment spaces already, and we didn't stop there. Thanks to the support of the amazing civil society organizations like Fresh Start, the charities and the nonprofits and all the volunteers, all the coaches, we've been able to do more than we thought possible at the beginning. So today I am really happy to announce that Alberta's government is now funding over 8,000 additional annual treatment spaces in this province. It's good news. It is great news. Every year, over 8,000 more Albertans are going to have access to fully funded medical detox, residential treatment, residential recovery services that were not available before. All of this is with no more paying for out-of-pocket user fees and no more requirement to sign up on welfare. This is going to help thousands more people access treatment that supports a full and lasting recovery. And there's more to come. As part of Alberta's economic recovery plan, that's the plan we have to try to get past the big recession and the energy price collapse that we got with COVID. As part of that plan, we're building for the future with 5 new recovery communities across the province that'll provide long-term residential treatment for those who need it. These recovery communities will themselves provide 400 new treatment beds, increasing provincial bed capacity by 30%. There are so many great things happening in this area. I mean, look, there's no shortage of bad news about the opioid crisis in this province that has been worsened and accelerated by COVID. But there's a lot of great things happening, and we need to celebrate those as well. And I want to salute Minister Ellis for his leadership in this area. It's clear that Alberta is leading Canada by establishing a recovery-oriented system of care. And to build a true recovery-oriented system, we need to focus our energy on outcomes for Albertans. Recovery is so much more than just not using drugs. Recovery is also about supporting wellness by improving aspects of life, like getting back into the workforce, finding stable housing, reconnecting with family and friends. Our new recovery-oriented system of care must ensure that services are judged based on outcomes and that individuals must be able to set their own personal goals, because one size does not fit all. We know that there are many pathways to recovery and that people with the illness of addiction should not have to start over every time they slip up. To accomplish that, we're also announcing today that Alberta's government will begin implementing an integrated software to connect all of our great facilities across the province together across the addiction care system. This is the My Recovery Plan software, and it'll begin connecting the addiction care system early in the new year. This software will also help Albertans improve their lives in recovery and will support Alberta's government in transitioning towards a system of care that's based on individual outcomes. So that means if somebody begins at detox and they go to a treatment center, and maybe they drop out, and they go eventually to another treatment center, we want their coaches and their counselors to be aware of the kind of treatment that they've received, to understand their history, their unique challenges and struggles, so there's not these huge gaps that people fall into in between. This is a large-scale shift, and it's the first of its kind in North America, I'm told. That being said, there's a heck of a lot more work to do. We'll continue to be guided by the evidence that is in front of us every day, that the most important evidence being the thousands of women and men across Alberta who live their lives in healthy recovery. It's clear that recovery is possible for everyone and that recovery works. It takes major courage and strength to choose treatment, tremendous strength of will to see it through, and a real commitment to stay clean and sober. So to the folks who are in the program here and the graduates, I want to say you are the greatest encouragement and the true heroes of the battle against addiction. For those who are struggling right now with that trap, they need to know that you, folks like you, represent a hope for a better life and a brighter future. So God bless you all. Thank you so much, Fresh Start, and we look forward to working with all of you guys to make these 8,000 additional spaces available to the Albertans who need them now and in the future. Thank you so much.